All right, thanks for joining me. Today we've got a fun topic to go over that is a pretty common question that I get quite a bit, and that's what's the difference between Original Medicare and Medicare Advantage and which one is right for me? So we're going to get into that today. So we're going to go ahead and get started here in just a second. And welcome back. Once again, my name is Drew McCormick with the McCormick Agency of Healthcare Solutions team. And today we're going to get into a fun topic, regular Medicare versus Medicare Advantage. Everyone wants to know what the difference is and which direction is better for you. And we're going to do a deeper dive into each one and how they work. But, the short answer is, it kind of depends on your situation. In some cases, it might make more sense to look at regular Medicare. In some cases, it may make more sense to look at Medicare Advantage. Each scenario is a bit unique, so that's where you can work with a broker like myself, and we'll try and figure out which direction makes more sense for you. But, the purpose of today's webinar is to kind of go into further, deep dive into each one and hopefully give a little bit more clarity for you. So we'll go ahead and get going. So in today's agenda, we're going to go over the choices that are available. We'll get into the different enrollment windows for regular Medicare versus Medicare Advantage. We'll go into the different coverage options, how the networks work for doctors and hospitals for both options. We will get into how the billing works, some of the extra bells and whistles that are included in each option, how prescription benefits work, and then just some of the upcoming changes that we've got going on. So getting into the different choices. So the two directions you have when you sign up for Medicare is you've got Original Medicare, which consists of Part A and Part B. I do have I do have a different YouTube video that goes into a much deeper dive into what those different parts mean. So check out that video if you're curious. But Original Medicare is going to consist of Part A and Part B, and then you'll also need generally a Medicare Supplement, and then Medicare prescription coverage, Part D as in dog, to encompass what Medicare Advantage basically kind of takes those different pieces and puts it together into one unit, so to speak. Whereas with Original Medicare, you can wind up with a few different insurance cards. You'll have your one card will be your Medicare card, the red, white, and blue card. One card would be your Medicare Supplement card, the Part D prescription card, and then if you have dental vision, so you can have several different cards when you go with the Original Medicare route versus Medicare Advantage, which in some cases can encompass all of those different parts into one package. But Medicare Advantage basically outsources your benefits from Original Medicare from the government to a private insurance company like United Healthcare or Aetna or Humana, Blue Cross, whoever. There's several different companies that have these Medicare Advantage plans. So enrollment for regular Medicare, for Original Medicare, is when you turn 65, or if you have, if you're not yet 65 and on disability, is the other direction or other way you can get on to Medicare. And you'll have your initial enrollment period for regular Medicare, which is going to be the 3 months before your 65th birthday, the month of your 65th birthday, and then the 3 months after your 65th birthday. So the initial enrollment period, I should say, is actually a 7-month window where you can sign up for Original Medicare. So once again, it's 3 months before, the month of, and 3 months after. Now, if you miss that window, you'll have to wait for the next general enrollment period, which is January 1st through March 31st of every year. but then the benefits don't actually start until July 1st of that year. So you really want to catch that initial enrollment period if at all possible. Unless you're working and covered by your employer, you can delay your initial, signing up for Medicare right away. But in most cases, you're going to want to sign up when you turn 65, unless you're still working from your employer. Because if you miss it and have to sign up for that general election period, you can also be subject to some late enrollment penalties too. So keep that in mind. So moving on to the delayed enrollment, this is what I kind of mentioned before. If you're still working for your employer, you can delay your signing up for Orignal Medicare if you're still covered by your employer. So I kind of touched on that already. Now the enrollment for Medicare Advantage. So to be able to in order to sign up for Medicare Advantage, you have to be signed up for both Parts A and B with regular Medicare and paying your Part B premium too. Sometimes people get that confused because you'll see it, especially if you watch a lot of commercials. You've probably seen them with Joe Namath. They advertise these $0 premium plans. Which is true. In some cases, you can get a $0 premium plan, but keep in mind you'll still have to pay your Part B premium unless you can qualify for some low-income subsidies that can get you out of that Part B premium. But in most cases, you're going to still have to pay that Part B premium. Now, your initial enrollment period is actually the same as original Medicare. So you still have that 3 months before your 65th birthday, the month of, and the 3 months afterwards. So that is also the same. Now, if you miss that, you have to wait until the annual enrollment period, which is where it's a little bit different than regular Medicare. For the annual enrollment period is every year between October 15th and December 7th. Is the enrollment period, and then the benefits will then kick in for January 1st of the following year. So so that's your window of opportunity to make a change on your Medicare Advantage plan. If you decide to elect into a Medicare Advantage plan from having a Medicare supplement, you can do so during that window. So every year, once again, October 15th through December 7th is your window of opportunity. So moving on. Now, for the most part, when you sign up for a Medicare Advantage plan, you're kind of locked in for the year, with the exception of the first 3 months of the year, which is referred to as the open enrollment period, from January 1st through March 31st. Now, this is if you're already on a Medicare Advantage plan, you can make a change to it during that 3-month window. So it's not very well reported, really, but it is your opportunity if you kind of have, second thoughts, if you want to go back to a Medicare supplement plan or original Medicare, assuming it's your first time on Medicare Advantage, you can do so during that window. So that's once again every year from January 1st through March 31st. Now, outside of that, if you want to make a change to your Medicare Advantage plan, you'll have to wait until the open enrollment period, or the annual enrollment period, I should say, which once again is October 15th through December 7th of every year. So that, in general, to keep things simple, the annual enrollment period is your opportunity to change your Medicare Advantage plan if you wish to change to a different insurance company, if you wish to, upgrade your plan, downgrade your plan, kind of whatever you wish to do. You can do so during that window, as well as if you're on original Medicare and you wish to change your prescription coverage, that is also your opportunity to do that, is the October 15th through December 7th window. So now outside of that, if you want to make changes to your Medicare Advantage plan, you would need a special enrollment period. So those are going to be major life changes, essentially. So similar to what you're used to through your employer, which just kind of a quick side note, the Medicare Advantage plans, to me, are kind of designed to look, act, and feel like the employer coverage that you had when when you were working. Since they've taken all those different pieces and put it together in one package, you get one insurance card that has copays, has deductibles, has out-of-pocket expenses, which is very similar to what you're used to through your employer. So quick side note there, but. So changes to that, you'll need a special enrollment, which is also pretty similar to what you're used to from employer coverage, is that you can't necessarily make any changes unless you've had a qualifying reason to do so. Like if you change your residence, say you move to a state where the plan you have isn't offered, you can make a change. Or if you lost your employer coverage, you can make a change. If there's a change in your Medicaid eligibility, say your income goes down, or for whatever reason you're determined to be eligible for Medicaid, you can also make a change at that point. If you go into a nursing facility or leave a nursing facility is another reason you can make a change with your Medicare Advantage plan. These are just a few kind of some of the more common ones that you run into, but that's not necessarily an all-encompassing list. In some cases, or even whatever state you live in, some cases they may make a special enrollment for people. So check with an insurance broker like myself. We can walk you through that process. So for coverage, we'll get into next with Orignal Medicare. Under Part A, you've got your facility coverage. So for most part, it's going to be hospital type expenses that will be covered under your Part A. And the deductible for Part A is $1,000. Keep in mind this does change, but as of right now, about $1,408, or not exactly, I should say. Now, for days 1 through 60 that you're in the hospital, there are no copays for that. Now, if you're in the hospital for a longer period of time, for 61 through 90 days, there is a copay of $352 for each day that you're in the hospital. Now, any days beyond 90 days, that's where Medicare stops paying, and that's where you would have to pay. So days 91 and beyond, that's where you have to pay for all of the costs. So it's $704 for each lifetime reserve day, and you get up to 60 days beyond those lifetimes. So then beyond the reserve days, that's where you have to pay. So you get 60 of those lifetime reserve days to kind of cover you if you go a few days over that. But like I said, after 60 days, of lifetime benefits, that's where you would have to pick up 100%. Under your Part B, and once again, this changes a bit each year, but it's currently at $203 is the calendar year deductible for your Part B. Now, Part B, assuming you have Medicare Supplement, and not going to get necessarily into too much detail of which exact supplements, but we'll talk about G for now. It's certainly one of the more common ones. All of those deductibles we talked about for Part A will be covered by your supplement. Now, the only thing not covered, once again, assuming we're talking about G, and we don't necessarily need to get into each individual Medicare supplement, but assuming you have Plan G, you just have your $203 deductible. Everything else is paid for by your supplement. So assuming you have regular Medicare, Orignal Medicare, I should say, A and B, you have your supplement, in this case we're talking about G, and then you have your prescription coverage D, to have all the different parts together that, once again, Medicare Advantage in a lot of cases put those different pieces together. So So then, I'm sorry, but without a supplement, I'll take a step back. You are then responsible for 20% of any charges beyond that, and there is no limit to that. So once again, that's where the Medicare supplements come into play, because they pick up the remaining 20% not covered by original Medicare, providing you an out-of-pocket limit, where original Medicare does not have that. So that's one of the biggest downsides to original Medicare, is if you do not have a supplement, you're on the hook for 20% of all of the charges. That's why, if you're looking at original Medicare, I'm going to strongly recommend that you get a Medicare supplement to pick up that remaining 20%, so you're not on the hook of, 20% of a large hospital bill could still be a lot of money. So that's where people can get themselves in trouble if you're just purely relying on original Medicare without a Medicare supplement as well. And as long as we're talking about the Medicare supplements, one thing that is different for original Medicare versus Medicare Advantage is that which insurance company you get your Medicare supplement from really doesn't make any difference. The Medicare supplement from company A to company B to company C is all the same. The only thing they can do differently is they can charge you a different amount for that. Whereas if we're talking about Medicare Advantage, the insurance companies can make a pretty big difference plan to plan. So for Medicare supplements, the plans are the same insurance company to insurance company. Something to keep in mind. Now for Medicare Advantage, as I kind of mentioned earlier, Medicare Advantage, as far as the coverage is concerned, is really going to resemble the type of coverage you had from your employer. So you'll still have deductibles, you'll still have co-pays, you'll still have co-insurance. A lot of those insurance terms that not necessarily everyone even understands. A lot of people know what their deductible is, right? But a lot of those terms that you may or may not be familiar with are still in your Medicare Advantage plan. So they're, once again, they do look, act, and feel very similar to what you're used to from an employer plan. So, for example, when you go say you get a cold and you want to go see a doctor, you're going to have to pay whatever your doctor visit copay is. And depending on the plan, it could be $10, $20, $15, somewhere around there is what you'll pay is kind of your cover charge to see the doctor. Now, if they want to do any other services beyond just, seeing the doctor, it'll, be billed towards your deductible, or you'll pay whatever the applicable copay is for that service. Co-insurance. So once you've met your deductible, then you're going to split the bill with the insurance company. It varies once again, but 80-20 is kind of the norm, so to speak, where the insurance company will pay 80%, you'll pay 20% up to your out-of-pocket limit. Is how the Medicare Advantage plans work. Once again, pretty similar to what most people are used to from an employer health insurance plan. And so all of these plans will include a maximum out-of-pocket, which is an important thing to keep in mind as opposed to going with the original Medicare, which, keep in mind, does not have a maximum out-of-pocket, with the caveat unless you have a Medicare supplement. So once again, I'm going to say it again. I've already said it, but if you have original Medicare, make sure you have a Medicare supplement. Very important. But with Medicare Advantage, you don't need a Medicare supplement, nor can you have a Medicare supplement, because the Medicare Advantage plans have a maximum out-of-pocket. And it'll vary. In some cases they might have lower out-of-pocket limits, around $2,000 annually. Some cases they might be $3,000, $4,000. The highest allowable, which will vary a bit, but it's currently at $6,700, meaning that your basically worst case scenario would be $6,700. The most that your medical expenses could cost you would be $6,700, assuming it's an eligible expense. And some of the plans, and I would say a lot of them, have out-of-pocket limits less than that. And if that's a concern, there are one of the plans I like to include with Medicare Advantage. It's called a hospital protection plan, essentially, that you can use. They're very affordable, but they can pay off a lot of those out-of-pocket costs if you're hospitalized. So something to keep in mind. Talk to your broker about. Now, here's an important thing we're going to get into for how the networks work for regular Medicare versus Medicare Advantage. Now let's talk about the network for Original Medicare. Everyone always wants to know, is Original Medicare, is that a PPO? Is it an HMO? What type of network is it? And it really isn't a network is kind of the simple answer. It'll more resemble a PPO than anything, but technically Original Medicare is not a network. It really just comes down to whether or not the doctor accepts Medicare, which I would argue is certainly a majority of doctors across the country accept Medicare. Not all, but I would argue a majority of doctors like to accept Medicare. So as long as the doctor accepts Medicare, you're fine. So you can search for doctors that accept Medicare by going to medicare.gov or by calling up your doctor's office. Sometimes that's a simple solution to just give them a ring and say, hey, doc, do you take Medicare? And most cases, the answer is going to be yes. Quick side note here is that, once again, assuming you have a Medicare supplement with your Original Medicare, is that as long as your doctor accepts Original Medicare, they're also going to be accepting your Medicare supplement, once again, regardless of which insurance company it's from. Now, the network for Medicare Advantage plans. Now, this is an important distinction for Medicare Advantage versus Original Medicare. With Original Medicare, once again, you are good anywhere in the country provided that the doctor accepts Medicare. Now with Medicare Advantage plans, once again, this is going to be more where similar to your employer plan. Well, they're going to have HMO plans and there's going to have PPO plans. And regardless of whether you go HMO PPO, which in general my preference is good to go with the PPO, you're going to want to stay in the network. HMOs are going to be more restrictive as far as the network. A lot of them are going to be state-based, where you're covered within your state. You leave your state, they'll say you're covered, but it's in limited circumstances that are generally life-threatening emergencies for the most part. If you want to go see a doctor on an HMO, you'll be paying that one out of pocket because you'll be out of network and not an emergency service. Whereas with a PPO, you are covered across the country. Once again, you'll want to stay within the network if at all possible. And there are a lot of insurance companies that have some pretty good PPO networks that certainly most doctors accept. So in some cases, you'll have, with the Medicare Advantage plans, in a lot of cases, we'll find those $0 premium plans. Definitely on the HMOs and in a lot of places on the PPOs as well. Generally the difference is PPO, like I said, is my preference if at all possible. But in a lot of cases we'll notice that the copays and out-of-pocket are going to be a little bit higher on a PPO because they are more flexible as far as your doctor selection. So everything's a trade-off, but once again, my preference is go with the PPO. You won't regret having a PPO given the opportunity to have one. Okay, so now we'll get into some of the extras that are going to be available through regular Medicare as well as the Medicare Advantage plan. So with Original Medicare, you'll be eligible for your Welcome to Medicare physical is what they call that. So basically it's a physical that you get done within the first 12 months of when your Part B starts, as well as you have then annual wellness visits from there on out. Your original Medicare will cover preventative services, which is going to be pretty similar to what you're used to through your employer plan, or it'll cover cancer screenings, colonoscopies, diabetes screenings, mammograms, pap smears, many other preventative type services. Once again, pretty similar to what you've used to. The way preventative services are covered is generally pretty similar, original Medicare to Medicare Advantage. For the most part, it's going to be your preventative services will be covered on either one. Where we really start running into more extras, so to speak, is on the Medicare Advantage plans. I guess keep in mind that with Medicare Advantage, you're essentially outsourcing your benefits to a private insurance company like Aetna or United Healthcare, whoever. So they are trying to incorporate some more bells and whistles to make the plans more attractive than original Medicare. And in general, a lot of the plans, not all, but a lot of them will include dental and vision, whereas original Medicare does not include dental and vision, and in hearing aid benefits in some cases. So with original Medicare, to have dental, vision, and hearing, you have to get a private dental, vision, hearing plan, but some of the Medicare Advantage plans include that. Now, even then, in a lot of cases, you can still be better off getting a private dental, vision, hearing plan as opposed to the, quote unquote, free one that's in your Medicare Advantage plan. Some of the Medicare Advantage plans have fitness benefits. Some of them will have silver sneakers built in. Some of them have their own fitness programs. But basically what it is that at one of the participating gyms, you can have a membership included as a part of your Medicare Advantage plan. So some of them include also transportation for doctor's visits. Some of them will include chiropractic and acupuncture. So they try and, once again, include a few more bells and whistles, but really the big ones versus original Medicare is always going to be dental, vision, hearing benefits that Medicare does not cover. Now moving on to prescription benefits, once again back to original Medicare. So original Medicare, A and B, does not cover medications. So keep in mind, if you want to have medication coverage, you have to get a separate Part D prescription plan to cover your medications, versus Medicare Advantage, which a lot of them, not all, but a lot of them include that prescription coverage built in. So once again, it's kind of taking those different pieces and putting it together into one package, versus original Medicare, which you have several different pieces to form your package, so to speak. Now, some of the Medicare Advantage plans do not include prescription coverage if you don't need it for whatever reason. Maybe you have coverage through the VA or whatever, but a lot of them include prescription coverage. Once again, not all, but a lot of them do. And also, I suppose for simplicity's sake, in some cases it is a bit easier to have one card with Medicare Advantage, so that way you have the same card when you go to the pharmacy or the doctor or the hospital, versus original Medicare, you'll have your card for your doctor or the pharmacy, but there'll be different cards, whereas once again Medicare Advantage could have that same insurance card. Something to keep in mind. So upcoming changes, starting with the 2021 year Medicare Advantage plans, will start accepting beneficiaries that have been diagnosed with end-stage renal disease, the ESRD, because traditionally in the past, Medicare Advantage plans really haven't been an option for beneficiaries with ESRD. So it's one of the changes recently in there. I'm going to thank you for watching. If you've gotten this far in the video, hopefully I provided a little bit more clarity as far as these different directions. Now the $1,000,000 question: which one's better for me, right? And here's where I'd really recommend setting a point with myself. I'd be happy to take a look at your situation. try and figure it out. But in general, so with Original Medicare, the reason I like Original Medicare is it's very flexible. As long as the doctor accepts Medicare, you're good anywhere in the country. Now, with Original Medicare, you're always going to want a Medicare supplement, which, you know, the prices are going to vary state to state, but I would say on average, you know, for someone that's turning 65, it's going to be around $120 a month. You know, it's like I said, it's going to vary state to state, but, you know, on average, somewhere around there. So, you know, but now the advantage there is that you know exactly what your costs are each month. You know, the $203, once you've met that $203 annual deductible, you're done for the year aside from your medications. So in that respect, it is nice because you know exactly what your costs are. Now, versus Medicare Advantage, in a lot of cases for Medicare Advantage, you'll spend less monthly, especially if we're talking about some of those $0 premium plans. But on the trade-off, now you'll have out-of-pocket costs when you go use the coverage. So you'll have your co-pays and your deductibles and your out-of-pocket costs. So, you know, so it can be a trade-off. You know, so like I said, so each situation's unique. That's part of what I do, is kind of get a better idea of what my client's situation is, and then you know, hopefully we'll find some solutions that work for you, because I realize that Medicare is a confusing mess. So that's what I try and do, is simplify things as best I can for my clients. So don't hesitate to reach out. If you have any questions, feel free to leave them in the comments. You know, I try and address any and all questions that are left. But I'd like to thank you for reaching out. My contact info is there. My email is drew@mccormickhealth.com. My phone number is or my 800 number is listed there. If you'd rather call my direct number at 630-592-8207. So once again, thank you for watching. Thank you for taking the time to sit through this. Hopefully you found it to be beneficial. And we'll see you in the next video. Thank you.